Prior to conducting the measurements, three major activities and considerations must be done. Foremost, the examiner must conduct hand washing to prevent nosocomial infections, most especially during the pandemic. And he or she must also be addressing the identity of the patient by making sure that the patient is the real one to have the measures done, and to also explain to the patient the procedure in order to address any apprehension and to also answer the queries that the patient might have. To measure weight, use a standard balance or electronic standing scale. Make sure that the patient removes his or her shoes and heavy outer clothing before standing on the scale to prevent wrongful readings. Another indicator of patient's health is his or her height. Use a wall-mounted device or measuring pole or scale to do the activity. Make sure that heel-to-spine measurements is conducted by aligning extended headpiece with top of the head. Persons should be shoeless, standing straight, looking straight ahead with feet and shoulders on hard surface. And if need be, retake measurements with another examiner to promote accuracy. To measure this ratio, waist circumference is measured in inches at smallest circumference below rib cage and above iliac crest, whereas hip circumference is measured in inches at largest circumference of buttocks. Waist circumference alone can be used to predict increased health risk. A patient may have excess body fat when females are above 35 inches and males are above 40 inches. And now we proceed with the measurement of the blood pressure, which comprises of the systolic or the maximum pressure felt on arterial ventricular contraction, or the diastolic pressure, which means the elastic recoil of the heart. Take note that the proper size of the sphygmomanometer must be observed, as a small one would promote inaccurate high readings, whereas a large one would promote inaccurate low reading. Also, the proper placement of the bell of the stethoscope on the antebrachial fossa must also be observed to hear properly the Korsakoff sounds. The normal reading should be 120/80 mm mercury for systolic and diastolic pressures. It is noted that above 121/81 is considered pre-hypertensive, whereas above 140 to 99 is considered hypertensive cases.
Okay, I will be checking your temperature, pulse rate and respiration rate at the just have your M.
Temperature. There are two ways to conduct or measure the temperature. Foremost is the core body temperature through deep body canals such as the oral and the anal orifice, or through superficial like the axillary area. In order to save time and effort for the part of the examiner, taking of the pulse rate and the respiratory rate may be done vis-a-vis with temperature taking. Electronic thermometers would promote convenience among examiners, as it would beep once the measurement is done. A normal oral or axillary temperature is at 37 degrees Celsius, or that is between 35.8 to 37.3 degrees Celsius, and a reading of 37.5 would indicate a febrile patient. It is advised to take both the pulse rate and the respiratory rate to promote accuracy on the reading, most especially if the patient is not knowing that his respiratory rate is being measured. The most appropriate site to read the pulse is on the radial area, whereas some areas would include the carotid, popliteal, and the like. While taking the pulse rate, take note of the rate, the rhythm, the force, and elasticity of the bounding pulses. It is also advisable to take the pulse rate in 1 full minute to observe real accuracies on the count. An average of 80 beats per minute, or that is between 60 to 100 beats per minute, is normal among adults. Below 59 BPM is considered bradycardia, and above 100 BPM is considered tachycardia. While still holding the patient's pulse area, count the respirations or the rise and fall of the abdomen and the diaphragm of the patient. A normal count would be between 16 to 20. Again, 1 full minute must be observed in the count to observe accuracies. After taking of all the necessary measurements for the general survey and the vital signs, note all of the readings on the appropriate sheets. Make sure to compare the readings from the previous ones to note of any discrepancies or abnormalities of the readings. The patient must also know all of the readings in order for him or her to know of his own health status. As part of the proper protocol, perform hand hygiene every after contact with the patient.